बिस्मिल्लाहिर्रहमानिर्रहीम, अस्सलाम वालेकुम और खुशामदीद नाज़रीन। मैं हूँ आपकी मेज़बान नसरीन अख्तर और बर्मिंघम पब्लिक हेल्थ की तरफ से आपके लिए पेश कर रही हूँ हेल्थ मैटर्स का प्रोग्राम। और आज का हमारा डिस्कशन टॉपिक है हेयरिंग। अगर आपके हेयरिंग में कुछ प्रॉब्लम है, अगर आप सुन नहीं सकते या आप किसी को जानते हैं जिनको हेयरिंग की प्रॉब्लम है, तो हमारे स्टूडियो गेस्ट आपको इसके बारे में एडवाइस और गाइडेंस देगी। Welcome, Rabina Riyasat. Rabina, you're a hearing aid specialist?
That's right, I'm a hearing aid audiologist. I've been in the profession for nearly 11 years now, and my role is to test and diagnose for hearing loss and then prescribe hearing instruments from there.
Rabina, in terms of some of the statistics around hearing, I think they say something like 1 in 6 people are likely to suffer from hearing loss, and it's something like 10 million people in the UK that suffer from this?
Your figures are completely correct, Nasreen. The figures estimate that by 2031 the number of people in the UK who will have some form of hearing loss or deafness will go up to 14.5 million, and that's a huge increase from the 10 million or so that we have at the moment in the UK. And it is a huge problem within our communities. What I'm finding as somebody who tests the hearing and prescribes hearing instruments, that the average first-time user of hearing aids is actually getting younger and younger. Years ago it used to be 70s and 80s. Now I'm prescribing for the first time 50s and 60s age group. One of the reasons why hearing loss is so difficult to detect by an individual, Nasreen, is because it is an invisible disability. When the hearing starts to deteriorate, it does deteriorate without there being any pain. So usually the individual who has the hearing loss tends to be the last person who notices that there is a problem. Now, there are lots of very simple signs that our viewers can watch out for if they feel that they may be having problems with their hearing, or they may have a loved one who has problems. First of all, what they may find is that they're having to ask people to repeat themselves a lot more than they used to. Also, the TV volume might be going up, and your loved ones may be saying to you that the TV volume is starting to get a little bit louder. Now, Nasreen, this is a really difficult sign for an individual themselves who is suffering from hearing loss to actually detect. And the reason being is because when we're watching the television, we tend to have it at a volume that's normal to us, and hence you won't notice that it's going up. So if your family or loved ones are saying to you that the volume is going up, then do trust that that is the case. And last of all, in social situations, what may happen is when you're out with family at a restaurant, for example, you may find that you're having difficulty concentrating on one person who's speaking in front of you, and that's because the background noise is stopping you from hearing exactly what you want to hear. So my advice to anybody watching today who is seeing any of these signs, both within themselves or friends and family around them, is it may be time to get the hearing checked out. And what I also like to add, Nasreen, is that there is a physical warning sign as well, which is known as tinnitus. Now, tinnitus is a condition where the individual will sometimes perceive that there is a ringing or a buzzing sound that they are hearing, and only they will be hearing it. And it may sometimes come from one side, it may sometimes come from both sides of the ears, or sometimes it may be just in the head that the individual will hear that sound. Again, tinnitus is usually something that comes hand in hand with hearing loss. So if any of our viewers are experiencing any of these symptoms, it may be time to get the hearing checked.
Rabina, Some very important points आपने हमारे व्यूज़ को बताए कि अगर वो घर में टीवी देख रहे हैं और घर वाले उनको ये कह रहे हैं कि आहिस्ता आहिस्ता दिन ब दिन वो टीवी का वॉल्यूम ऊपर करते जा रहे हैं, तो ये एक साइन हो सकता है। अगर उनके एयर्स में कुछ बजिंग की नॉइज़ आ रही है या दोनों कानों में या एक कान में आ रही है, तो ये सब सिम्टम्स हैं कि शायद उनकी हेयरिंग जा रही है। और अगर वो किसी को कहते हैं बार बार कि वो वही सवाल रिपीट कर रहे हैं या उनको सही वो सुनाई नहीं दे रहा, तो उनको कह रहे हैं। ये आपने हमारे व्यूअर्स को बताया कि अगर ये कोई भी एक भी इनमें से सिम्टम्स हो तो उनको अपनी फौरन हियरिंग चेक करानी चाहिए।
जी हाँ, बिल्कुल।
तो रुबीना, आप बता सकते हैं व्हाट आर द कॉजेस ऑफ हियरिंग लॉस?
There are lots of non-preventable hearing losses out there. For example, when a child is born without any hearing, or somebody is more predisposed to having a hearing loss due to genetic factors. These things unfortunately can't be avoided. What I'd really like to speak to our viewers today about are those hearing losses that occur gradually in adulthood and are permanent. Now, there are many reasons why an adult may lose their hearing over time, and some of those reasons can be, for example, ongoing exposure to noise on the job. There are many medications out there that can cause a problem with the hearing, unfortunately, and my advice is, if you are taking any medications that you think have affected your hearing, I would speak to your doctor about this. And also head injuries, trauma to the head can sometimes lead to an instant hearing loss, and it can also be permanent. But more pertinent to the Asian community is things such as chronic conditions, and chronic conditions can include things like heart disease, high blood pressure, stroke and diabetes. Now, these conditions don't actually affect the hearing directly, but what they do is they will interrupt the blood flow to the inside of the ear, which can then affect the hearing. Now, obviously within our community we are at a greater risk of developing these conditions, so my advice would be to anybody who has these conditions, just keep a closer eye on your hearing, because the knock-on effect from conditions such as this can be a hearing loss. And also temporary hearing losses, Nasreen. There are temporary hearing losses which can, once obviously the condition has been removed, it then takes the hearing back to normality, and these can include things like earwax. Some people have very narrow ear canals, and unfortunately they will fill up very quickly with earwax. And when this happens, the nurse at your local GP can then have this removed for you, and it usually will return the hearing back to normality. And it also includes things like infections as well. Infections can occur obviously in the outer part of the ear or the middle ear, and once these are dealt with through either antibiotics or drops through your local GP, it will usually get the hearing back to normality.
Okay, Rubina, आपने बताया कि कुछ ऐसे कंडीशन है हेयरिंग लॉस के that if you're born with them, आपको पैदाइशी हैं तो शायद उनका कुछ ना हो सके, लेकिन कुछ ऐसे हैं कि जो एज के मुताबिक आ जाते हैं, या अगर आपको कोई और इलनेस हो जैसे कि डायबिटीज़, उनकी वजह से आपके, या कोई और लॉन्ग टर्म कंडीशन है, उनकी वजह से आपकी हेयरिंग इफेक्ट पड़ सकता है. And so it's in those instances it's very important that you keep a very close eye, if you like, on your hearing, yes, to make sure that those things that don't happen. Now, Rubina, what is the big, you've mentioned, slightly touched on noise as well there. What are the biggest causes of hearing loss?
Well, age and loud noise are considered to be the largest causes of hearing loss across the world at the moment. We are living much longer than we used to, so there is much more wear and tear on the hearing, and also we are living in a much more noisy environment than we did years ago compared to 20, 30, even 40 years ago. Now, the World Health Organization states that noise is the biggest cause of permanent damage to hearing at the moment across the world again. And I think the saddest thing about this fact is that this type of loss is completely avoidable. If we're not exposing ourselves to that noise, then the hearing loss won't follow.
Okay, Rubina, two things you've mentioned there: age and noise. Age you have no control over. Obviously you're going to get older. So as you get older, is there any particular time in terms of age when hearing loss is more likely to hit you?
Well, we would say around about sort of 55, 60 is generally the time where people will start to notice a hearing loss. So anybody who is over 55, 60, I would always recommend getting a regular hearing test conducted.
And the second thing is, and it seems like a very important thing, you've mentioned noise to me, which is something that can actually be prevented or may be preventable. So how can people avoid hearing loss from noise?
There is a very simple trick that you can use when you're out and about in a noisy environment and you're unsure whether it's going to be actually affecting your hearing. Now, if you're sitting at arm's length to somebody, for example, out in a restaurant, and you're having to shout to be heard and they're having to shout to be heard, then that noise is probably going to be damaging your hearing, and I would get away from it as quickly as possible. Technically, Nasreen, the level of noise which is thought to be dangerous to the hearing is 85 decibels and over. So if you're exposing yourself to this volume of noise on a regular basis, it will eventually cause a problem with the hearing.
85 decibels, I know a lot of our viewers will be thinking roughly what is that, some music playing in a wedding, or what would you say that would be at? Okay. What level?
Well, any sound that is of that level will cause a problem. Now, our viewers will be thinking, well, how do I know what's how over?
Loud, yeah,
how loud is too noisy? A common culprit, Nasreen, is going to be workplace noise, unfortunately. And within our community, we have lots of men and women who work in factories where there is constant machinery noise.
Of course.
Now, if they are not wearing hearing protection in that environment, they will be damaging their hearing, and it is the responsibility of the employer to actually provide this hearing protection, but it's the responsibility of the employee to actually wear the hearing protection when it's given. Now, noise isn't just limited to workplace, it can also happen within our own homes, and there are many appliances within our own homes that we use on a regular basis that can produce levels of noise 85 decibels and over. These include things such as lawnmowers, power tools, which everybody knows can actually produce levels of noise which are quite high, but even very sort of everyday things like vacuum cleaners, they can also produce very loud sounds, and fireworks, which we use recreationally. So if you are using an appliance at home which will be producing levels of noise that are too loud, it usually has a warning sign on it to tell you that it will be affecting your hearing if you don't use hearing protection.
So some of those everyday objects are difficult to avoid in terms of washing machines and vacuums and stuff. So is it to keep it to a minimum, or is it, a lot of people probably think, well, that's an excuse not to do the hoovering now?
You can always wear ear protection, and there are lots of different types of hearing protection available out there. I myself have a vacuum cleaner at home, and whenever I'm using one, I use the off-the-shelf hearing plugs that are available, and I believe we'll be looking at those later on in the show today.
Thank you, Rubina. Now, in terms of some people mention things like vertigo and hearing loss, or their hearing causes them to get some kind of dizziness, etc. Is there anything that you can tell us about that?
Yes, well, dizziness is a general term used when there is actually a problem with our sense of balance, and people may describe varying symptoms. For example, they may feel lightheaded, giddy, off balance, and some people may even describe the sensation where they are walking on a soft mattress, for example, or cotton wool, that sort of sensation. Vertigo is a specific form of dizziness. And usually the person will report that they feel the whole environment is moving in relation to them, or they're moving in relation to the environment. And it is a very severe condition. It's usually described as a rotary or a spinning sensation. Now, whenever somebody has a problem with dizziness or vertigo, it's usually the inner ear balance organs that are affected, and this is known as the labyrinth, and you have one on each side. Balance disorders arise from these sorts of symptoms. Alongside dizziness and vertigo, you may also have sensations such as nausea and vomiting. But there are lots of things that can actually cause balance disorders, and they include things like medications, ear infections, head trauma, or anything that can affect the inner ear or the balance organs can actually lead to a problem with dizziness or vertigo. So the main thing is, if you are obviously experiencing any of these symptoms, I would always go and see your doctor. They are the first port of call, because even though you know, these may seem like small things on the surface, they will affect your life, and you will find that you can't do everyday things when you're experiencing dizziness and vertigo on a regular basis.
Rubina, can you tell us a bit about whether this is myth or a fact? Sometimes some of our viewers or people may feel that when they go swimming, and there's almost a conception that once you've gone swimming, your ears become blocked. Can this affect can this lead to vertigo if they're blocked for a number of days, etc.?
Well, if your ears are blocked, I mean, when somebody goes swimming...
or even in the shower?
Yeah, I mean, if you get any sort of water inside your ears, wax is it's a bit of a weird thing, because it actually has different types of properties. It can absorb the water, and it also repels it as well. Now, when you go swimming or you get water inside your ears, because the wax will absorb the water, it will swell up, and that can block up the ear. And obviously, if it's blocked up with water and it's humid in there, it can lead to infections eventually, which can make the hearing go up and down. So yes, when you do go swimming, sometimes you can get the sensation that the ears are blocked up, but usually that resolves itself.
And I've also heard, and this might be a complete myth as well, and you'll put me right, that if that is the case, if you tend to chew some gum or have a chewing action in your mouth, that may help unblock your ears. Is that?
It can do, because it moves the ear canal around, so obviously the blockage will be more likely to come out by itself. And also it makes the pressure on both sides of the ear canal equalise when you're chewing something. So this then causes things to balance out between the ear canal and the middle ear, and usually causes the blockage to be released.
Okay. नाज़रीन, ये थी हमारे स्टूडियो गेस्ट रुबीना रियासत, हेयरिंग एड ऑडियोलॉजिस्ट, जो हमें स्टूडियो में आज बताने के लिए आए हैं कि अगर आप के हेयरिंग को अफेक्ट है तो आपको क्या करना चाहिए, कितनी जल्दी आपको अपॉइंटमेंट बनाना चाहिए। और दो बिगेस्ट फैक्टर है हेयरिंग एड में जो इन्होंने बताया है, वो है एज और नॉइज़ से आपको कैसे परहेज़ करना चाहिए। चलते हैं हम छोटी सी ब्रेक की तरफ, और ब्रेक के बाद ये हमें और बताएंगे इस सब्जेक्ट के बारे में।